Hello Lima, brought to you by Good Food Restaurant, home of Happy Days, Beer Barrel, and Old City Prime. Also by Mercy Health Partners, 318 Restaurant and Bar, Lima Palette Company, and Fresh and Faded Hair Studio.
Welcome to Hello Lima Community Perspective. Coming to you from the area's, what I say, the leading healthcare provider, Mercy Health System. It's a pleasure being able to be at Mercy Health System. One of the things we've talked about is that over the last year, almost a year to the date, COVID-19 has impacted the community like no other. World War I, World War II, 9/11, more deaths have happened of COVID-19 than all three of those incidents combined. What we're going to talk about is the impact, particularly that impact in the Black community and how it, from a disproportionate standpoint, has affected the African American community. So I'm going to be a little different today. I'm going to be a segmented type of show and talk about the impact in the Black community. And I hope our audience for Hello Lima understands the importance of that. Joining me today is Dr. Singh. Dr. Singh comes with us from Mercy Health System and Specialist Family Medicine.
Yeah.
From Atlanta.
I am from the Atlanta area, yes.
Dr. Singh is an advocate of healthcare equity, particularly in the Black and Brown communities. So we're going to be anxious to hear what you have to say. We have a esteemed panelist, doctor, I like to say, and they're going to be joining us also. We have Jesse Pope. Jesse, retired engineer from Cooper Tire out of Findlay, longtime community activist. We have Frank Lamar, former Perry Township trustee, as well as Economic Development Board member and retired from Ford Labor Union. And everybody knows Jerry Pitts, local advocate, as well as legal scholar. Let's take 34 seconds, and I want you guys to watch this video, because if we're going to talk about how we got to the point with this disparity in the vaccination rate, maybe we have to talk about the why first. Let's watch this.
What the United States government did was shameful, and I am sorry.
We have no idea how many wives, girlfriends, children inherited the disease and also died or were forever crippled by its effects.
For 40 years, the U.S. government-operated public health service conducted what was known as the Tuskegee Syphilis Study, one of the darkest chapters in American history.
Welcome back. So that video, though, and I'm going to start with you, Frank, if I could, coming into the Tuskegee experiment. When you talk about that experiment, then I'm going to jump over to you, Jerry, and get a legal perspective. And we have so much to get through. We're going to be somewhat quick with this, but I think it's important to talk about that Tuskegee. Frank, you're from Alabama. You certainly have grown up in the Jim Crow era. You understand how it impacted not only you as personally. I've heard some of your stories in the past, but certainly if we talk about the vaccine and why Blacks aren't getting the vaccine, the Tuskegee experiment has to be on everybody's mind. It's been talked about in the community. I know Doc has some relationship with it. But when you talk about, they took 600 Black African-American men and gave them syphilis or didn't treat their syphilis. And at the end of the day, they never told them that they weren't getting treated. And so when you talk about, well, that happened, but the government did it, Frank. The government, which we know as the CDC, implemented that experiment. Tell me, Frank, from your experience, do those types of history resonate even today as we talk about the disparity in healthcare?
I think so, Jerome, because people was misinformed about the Tuskegee incident. And what happened was, I believe, as I recollect, and I was a young kid at the time, but that was a situation where this virus, they had a vaccine for it, but they was giving the vaccine to minorities. Now, in some instance, the way I understand it, they was giving also the virus instead of the vaccine. And right. Then when they would give them the virus, then they would give other people the vaccine to try to do away with the virus.
Right. So in Macon County, Alabama, where this happened, Frank, do you think it still resonates with people today? Do you think people still feel the racist and how the government was able to do that, Frank, with so little oversight?
Well, what we have today is a lack of trust, and that's a mistake.
In the Black community?
In the Black community, you still have a lack of trust. People they're saying, well, I don't know whether they're giving me something to cure the virus or giving me something to enhance the virus.
Right. And
so that's the feeling a lot of people think, but
Jesse, I'm gonna get with you, but Frank is right. There's a myth going around now that the virus comes in a twofold method, and the first shot is to give you the virus, and the second shot is to take the virus away. That's a myth that's in the Black community as we do this research. Jerry, when you talk about from a legal standpoint, and Frank, you brought up some good points. Jerry, Tuskegee experiment did not stop until 1972. Let that sink in, Jerry.
Well, actually, it's 1973.
Yes.
I need to clarify one thing.
Yep.
Of the 600 people, 301 was given the syphilis.
Right, Jerry.
299 was given a counterfeit situation, and they claimed that they was treating them all, but they actually wasn't treating any of them. They was pretty much providing them with something as simple as aspirin and some kind of tonic, telling them that this was going to work in their behalf. Now, this had occurred in 1952.
Right.
Now, the lawsuit is still, there are lawsuits still pending in 2021 dealing with allegedly the $100,000 and how to deal with it.
That's still left on the $10 million settlement.
The courts have refused to release it still. Now, also, you need to understand that what they call the Tuskegee effect. The Tuskegee effect is, this is where the mistrust comes from, where the government itself had sponsored that program, led that program, and what it has done, it has still traumatized people today.
In the Black community in particular.
What we have not understood is that untreated syphilis, and I'm sure I'm referring to the doctor, but it has went from generation to generation to generation. There are still children, parents, women, children who have some effect from this to this day. Now I'm going to just talk real quickly about what monies were involved. Those who got syphilis and died, their family got $37,500. Some of their heirs got $5,000. The children and women who encountered that, the government says, we're going to give you medical and health benefits for the rest of your life.
And when we get on that subject, and those are good points, and what we're trying to do here as we talk about this is not to what you say, and I'm going to jump to you, just is dig up old bones. Follow me, Doc. But it's important for people to realize how we got here. Doc, you have some understanding of the Tuskegee experiment?
Absolutely. I think these are big, important concepts that we shouldn't be trying to sweep under the rug. One of the first things I always tell my patients when building a relationship with them is, feel free to be completely honest. There's no judgment. Ask all of your questions, no matter how crazy you might think they are, because they're real questions that other people probably have. And so being from the state of Georgia myself and, being a person of color, certainly this is real distrust that, it's warranted. Based on everything you're telling me, this is very real. So when we talk about this, we need to be very clear about our transparency. The COVID vaccine process, we ought to be as transparent as possible because we don't want things that have happened in the past to happen again. We need to learn from our mistakes as a healthcare community and as a country.
And when Jerry talks about the funding that I would call the settlement, right, Jerry, that was peanuts. And at the end of the day, over time, and I think that's what Jerry was trying to get to, Doctor, that over time, it just builds up and people get frustrated and people get angry and people have a mistrust. And I think that was Jerry was alluding to. Jesse, have you, did it impact your thoughts at all when you think about this health disparity, particularly when it comes to the COVID-19?
Sure. I also grew up in the Jim Crow section of the country. And matter of fact, I was born in Alabama as well. But the impact of it, this is over a 40-year period. I mean, so it's not like it was something that just happened and it's a thing of the past. This is continuing to go on now. The thought is, though, that the message was there
at the time,
and the message is spread into the generations after those that were there too. So it's always important to realize who the messenger was,
right?
And that message has not been cleared up.
And when we come back, we're going to go into a quick break here, but Jesse brings up a good point. It says, statistics says, doctor, when you put FDA in the discussion about COVID-19, the amount of people taking the vaccine drops by 7%, which means it's that much mistrust when it comes down to the government, particularly in the African-American community. When we come back, we're going to hear from Doctor about what questions that she's having on the front line and how she can do and how she's making sure that the patients are understanding this COVID-19 and how we can get more shots in the arms of African-Americans. Be right back.
From early in the morning when the Happy Days stores open, turn the grills on, get the coffee turned on. Across town, the beer barrels, there's a lot of prep work that has to be done. Sauces being prepped on the stove. At Old City Prime, everything's from scratch. I think the culture in our company is that we care about our people. And in return, our people care about our customers. Thank you so much to all of our team that's worked for us, and thank you so much to all the communities that we're in for being such great customers.
You are the center of a universe. That's what we've learned in 160 years serving our community. Everybody means the world to someone. So when you're in here, or if someday you find yourself in here, and when all you can think about is the world that revolves around you, we'll be a world that revolves around you too. Mercy Health. Healthcare for the universe of you.
Welcome back to Hello Lima. Pretty exciting conversation here, although it's somewhat depressing. At the end of the day, the guests have been talking. If you don't understand the history, it's hard to talk about the why. And that's what we've been talking about when we talk about the Tuskegee experiment and hearing some of those who lived through that. Doctor, we are seeing some clips of Mercy receiving the COVID-19 vaccination back in December. Can we ask you, let me talk to you quickly about this. The hospitalization of COVID in Allen County has been 18%. The African-American community as a whole only make up 12%, but out of the entire hospitalization, 18% have been in the African-American community. So as those numbers have been so prevalent, not only throughout the state and throughout the country, Lima is no exception. We are facing disparity at an unprecedented rate. And if people think, though, Doc, and we're going to come back to the guests, that it's only going to affect you people, follow me, they're wrong. The vaccination, everybody has to get vaccinated in order for the country to get back to normal. So when you have the numbers that you're having, particularly in the Black community, we have to talk about that, and we have to have people like you in a position as a clinician to say, trust what I'm saying, here's what tell me what you're hearing on the front line and questions that you're getting.
So let me start by saying that I have gotten both vaccines myself. In fact, I was the first person in this hospital to get the second dose of the COVID vaccine. So I do trust that process fully, and we'll get to some of those questions. I was seeing and managing COVID patients in the hospital when we at the hospital were at our highest percentage of COVID. Yeah, we're in the highest numbers that we had. And I want to be really clear that, you know, those of us from Black and brown backgrounds, there's no reason that we shouldn't have just as good of an outcome related to COVID as anyone else who gets the virus. And so this disparity that we're seeing, it's a question. I mean, it's why are we seeing this? And some will say, you know, it comes down to whatever medical conditions you had before you got the virus, you know, and that may be part of it. But I will say that a lot of it comes down to access to health care.
Yes. And I want to hold you there because I think it's important. People have excuses as to why this disparity exists, but those excuses are what drives the mistrust, which means when you say, well, it's because there's more morbidities in the Black community, or Blacks don't have lived together in more congregated areas in the urban city, or Blacks don't, follow me, it just kind of divides that wedge that says, well, you have it because that's the way you people are, that's the way you live. When you're talking about it comes down to education, access, and a better trust level for the government. Exactly, and all these things that you're referring to, which is a lot of people crowded into small spaces, you know, not having the education, these are long-term effects. Yes. on racism itself. Exactly. And systematic processes that doesn't allow Blacks to be able to work and live at the same rate and thrive the way that other people of other races do. So what are the patients asking you, Doc, when it comes down to taking the vaccine? And I know you're... So I think probably a few of the most common questions I get are,
oh my goodness, this has all come up so quickly. Is it safe? How do I know it's not experimental? And I think that is an important question that ties into everything we're talking about. And the very first thing I want to share with people is, I would not have gotten this if I didn't trust it, one. So as your provider, I do recommend it. And two, it's a different kind of vaccine. It's an mRNA vaccine, and certainly mRNA is something that the science world has been studying for decades for all different kinds of vaccines, from CMV, flu, rabies vaccines to cancer treatments. It's a well-known mechanism. And in that, it's very safe. It doesn't affect your DNA. It doesn't affect your cellular structure. It doesn't affect or change who you are as a person.
It's been tested. Mm-hmm. Jerry, if I can jump back to you, when you talk about the Tuskegee and maybe the misinformation that's out there in the public, and doctors doing a good job clearing it up, should we or could we do more in the Black community to dispel the myths and some of these that are coming through the Tuskegee, or is it a lost cause, somebody who's in the legal system and working every day in public?
Well, it's not a lost cause. I think, like anything else, information would be a valuable tool. I think with the virus being such that we haven't been able to utilize the ministers in the community as much as we normally do as our information pipeline.
That's a good point.
And that has not occurred as much. And I believe that we do need to get the ministers more on board to have that information go out. Mm-hmm. And also to work with the lack of trust that is going on. Some people have never been to a doctor in Allen County. Never. There's people who's never even left Allen County in their life. So we need to deal with those certain situations. And it comes more with the education. And we're going to have to find out who the community really have trust in. And a lot of us professionals, they see us from a distance, but they really don't have that relationship with us.
And Justin, Jerry brings up a good point. COVID-19 is just one of the issues. Follow me? The Allen County has had a disparity, particularly in the African-American community, for years. Follow me, Jerry? So to just sit here and say, oh, COVID-19 is now showing its ugly face about what this disparity is, Jerry's right. For years, Lima, Allen County has done a poor job, and you can point fingers on whoever you want, right, Frank? But at the end of the day, if we don't do a better job, generation after generation is suffering. And Frank, before we go back to Doc, what could we do? And Jerry brings up a good point. You don't have the bully pulpit at the church anymore to have this dialogue. What can we do, Frank? You've been through the worst of the worst when it comes down to you and Jesse and the Jim Crow laws. What could we do to eradicate this disparity for our grandkids?
Well, here in Allen County, Jerome, as just mentioned a few minutes ago, we have many minority churches. And as of now, I don't believe most of these churches are having Sunday services. But that doesn't keep them from communicating with their membership. They can do it.
Find other methods.
And let them know that this is something that they should do. They should take this virus, take this vaccine, and to get rid of this virus. Because as a rule, minorities, and this time of year is coming, well, we communicate a lot with each other. We have outside activities. We have cookouts. And
use those for...
The other thing is, sooner or later, we're going back to churches.
And yes, let me ask a question here real quick. And I know Doctor has taken it. Out of the three of you guys, how many have taken the vaccine?
I
have taken my, scheduled to take my second shot next Wednesday.
Outside of me, we're 100% vaccinated in this room, in the African-American populace that's sitting in this room. Let me ask you a question, Doc. Let me start out with here, and tell me what you think about this. Many doses, this is out of the Wall Street Journal article a couple of days ago, many doses are going to large hospitals and pharmacies that don't operate facilities in predominantly Black and brown communities. You're sitting in the healthcare system, Mercy healthcare system, that is in the heart of 30% of the populace of the Black and brown community. Could there be more coming from this institution, who's always been a strong advocate of health in the Black and brown community? What role or what avenue could this hospital, when you look out the window and see so many Black and brown residents? looking for hope, looking for opportunities.
Yeah, I completely agree with you. I think Mercy and St. Rita's has done a really good job of, even giving us this platform to talk about it. And this is extremely valuable.
Yes.
And I think it's just going to be, there's so many levels to it. One is going to be that grassroots outreach, get out to your people, your patients, whoever you know, and share the positivity, the good outcomes, share that, and word of mouth spreads, and then go from there to, just like you guys are saying, the trusted figures in the community. And I think Mercy is very supportive of what can we do to get out there? Who can we get to? Tell us how. We want to get in there, and it's just going to be about education,
and informing the public that it's safe, because you're hearing a lot of, from what I'm hearing, and I want to make sure our public gets this, our audience. You're hearing that may be, and I don't want to put words in your mouth, the number one reason as to why they're not taking it. Is it safety, or is it or fear of?
I think it's doubt, and it's fear, and it's, hey, no one else I knew got it, so I won't get it. And that is a logic that people apply to the flu shot every year, other vaccines too. So, I mean, the more contact we can have with people in whatever form to tell them, you have questions, we're here to answer them. Don't be worried to come talk to us. We're just like you. We had the same questions. We had to have them answered too.
And as somebody who's on the front line, if I can use that terminology, and it's probably not a good analogy, given that it's not as dire as a war itself, people are dying every day, Doc, because they don't have the information. Frank, you want to jump in here?
I'd like to say just one thing. One thing we don't have. We don't have, I should say this. One of the problems, you have to make a reservation. You have to make an appointment.
To get the vaccine.
And we ain't good at doing that sometimes. Even when we are seriously ill, we almost at death a lot of times before we'll make an appointment to go to the doctor.
In the Black community.
If we had a system here in the Black community, some place where you just walk in and get the virus. Now, you got to have some control. I know that, because the vaccine is limited, I believe. That's right. You only have so much coming into Allen County. But that's one of the problems.
Is having access to that.
Most blacks ain't going to pick up the phone and call. They don't know who to call.
Right.
I can tell you this now. First time I called Memorial. They didn't have the vaccine at the time. I called St. Rita's. They didn't have it. They wasn't taking any appointment at the time. Finally, I drove to Bradfield Center one day. The next day, they called me in. So it's just that quick. Now, I go next Wednesday to take my second shot. My wife haven't had any because she's been in Columbus with her daughter because she's sick. So she will be home. Went in yesterday and asked if I could bring my wife along. They say, sure, why not? Bring your wife. Get her started.
Right. And having said that, though, we're going to take a quick break here and jump back in. Frank, I'm going to go back when we come out of break and touch on what you're saying is an issue. And I'm going to ask Jeff about that, is navigating the process. How do you get the vaccine? And for those, Doc, who don't have the internet or don't have access to what you call real-time data, how do I pick up the phone and who do I call to get that shot? We're going to talk about that when we come back here. Don't go away.
You are the center of a universe. That's what we've learned in 160 years serving our community. Everybody means the world to someone. So when you're in here, or if someday you find yourself in here, and when all you can think about is the world that revolves around you, we'll be a world that revolves around you too. Mercy Health. Healthcare for the universe of you.
From early in the morning when the Happy Days stores open, turn the grills on, get the coffee turned on. Across town, the beer barrels, there's a lot of prep work that has to be done. Sauces being prepped on the stove. At Old City Prime, everything's from scratch. I think the culture in our company is that we care about our people. And in return, our people care about our customers. Thank you so much to all of our team that's worked for us, and thank you so much to all the communities that we're in for being such great customers.
Welcome back. Interesting topic. Want to leave some time to answer Frank's question, to talk about the process of people getting to the information. Doc, I'd like for you to talk about it, if I could, Dr. Singh. Talk about this opportunity that Mercy is bringing in, somebody who can help alleviate what Frank was talking about.
So there's a few things I will say. First of all, I would tell everyone, contact the local Allen County Department of Health.
And we have those numbers on the board where you're speaking. They're on the screen now.
Perfect. And in that, they'll be able to tell you all the hospital-based clinics, all the local community clinics that are doing the vaccine. Can also probably point you towards people who can help you get on those lists that you were referring to. I know here in Mercy, we now have a vaccine navigator. Her name is Maxine. So she is just dedicated
Did you say a vaccine navigator?
Yes. So, and I'm so glad that we've done this, because this question that you're bringing up, this is a question that almost everyone has had. How do we get in?
And what's her job? What do you think she's going to do, Doc?
So I do think that she's going to make the process way smoother. It's going to be, call her, reach out to her office, and they will help you get on the schedule and get an appointment for actually both of your shots, just like you're referring to. So that is just here in our hospital, we're doing that. Other things I would say is, even if you have never seen a family doctor, just call their offices, and those are numbers that certainly can be shared too, and say, hey, I don't see you guys, but I want a vaccine. And I know in our clinic especially, we have people who are dedicated to just helping you with those resources and helping you make an appointment.
That's good information. I appreciate that, Dr. Singh, because one of the things we want to make you feel comfortable, and I'm glad you brought the fact that Mercy has allowed us in this space when no public space is really that acceptable. So they are pushing the boundaries of saying, how do we make sure, because if it weren't for them picking up the phone and says, hey, the African-American vaccination rate is at a point that is concerning.
Yes.
What can we do to talk about that? And that's given us an opportunity to make sure that, I'm going to ask some rapid questions here real quick, and I would just want quick yes or no answers. Jerry, when do you think it'll be over with? When do you think we'll be back to normal? Quick response.
No time soon.
No time soon. Frank, from your experience as a Jim Crow recipient and somebody who's lived through it, what's worse, Jim Crow, history of Jim Crow, or the pandemic that's killing blacks at an alarming rate? What has been the most depressing for you?
The most depressing thing to me is when I was trying to get an appointment, and you got to call, and you got to push this button, you got to hit 1, you got to do 2, then they put you on hold for 15 or 20 minutes, stuff like that.
Jesse, the economic impact that this has had on the black community, will we ever recover?
No, I don't think we will. And the reason for it is we're saying the pandemic, okay, but there was a pandemic prior to this pandemic in the black community.
Yes, thank you.
You know, all the essential workers are minorities, and that contributed a lot to the fact that the death rates are so high.
Jesse is an economic background, and he knows the black community was impacted by things far worse than COVID-19.
Absolutely.
And that's what Jesse is alluding to. And I appreciate Jesse being able to speak candid. And I hope our audience understands that as we try not to what you call segregate our great populace called Lima, Allen County, it's important for people to understand that everybody's struggles are the same. Follow me, doctor?
Yes,
that everybody's issues are the same. And so at the end of the day, what Jesse is talking about, if Lima, Allen County is going to be the strong community it is, we need people like Dr. Singh out in front. We need people like Jerry Pitts talking about what we can do to educate people, to let people know that the Tuskegee experiment is still hitting home today with regard to there are people right now, Jerry, they're living recipients of this syphilis that is hurt and harmed their lives. So again, I'm going to thank our guest, Dr. Singh. Look forward to hearing more from you and the public in terms of how we're eradicating the disparity in the vaccination rate. Jesse, I always appreciate you joining us and having such wise wisdom about economic impact in the black community. Frank and Jerry, I appreciate you. We're going to try to do some more of these through Mercy as we get going. Please don't forget, watch Hello Lima, Instagram, Twitter, as well as the Facebook page. And remember, Hello Lima.
Hello Lima, brought to you by Good Food Restaurant, home of Happy Days, Beer Barrel, and Old City Prime. Also by Mercy Health Partners, 318 Restaurant and Bar, Lima Palette Company, and Fresh and Faded Hair Studio.